In simple terms, surrogacy is an individual that's going to carry a pregnancy for another person. So the surrogates go through an extensive screening process before they can be approved. It's a long process. We actually eliminate about 90% of women who apply to be surrogates. We want to make sure that surrogates are healthy, that they've had uncomplicated pregnancies. They undergo extensive psychological screens, things like infectious disease screens, general health screens, toxicology screens. They go through testing to make sure that the pelvis is healthy. The last significant component to this is that there's legal contracts that are put together. Gestational surrogacy, which is really the predominant type of surrogacy that's performed in the United States now, is when we use the sperm and eggs from either a couple or sperm from an individual, eggs from an egg donor, and a separate individual carries those embryos in that pregnancy. Sometimes we have somebody have a family member or friend act as their surrogate. Most of the time people choose to work with a surrogacy agency. The surrogacy agency will follow that surrogate all the way through pregnancy, delivery, help make sure that the proper birth orders and birth certificates are placed in the intended parents' names. In regards to who can use a surrogate, we don't want to put binders or set rules in place for our patients. If we have a couple or an individual that wants to become a parent, we want to look at their individual circumstances. In regards to international surrogacy, we're on the Pacific Rim, so we have a great attraction of patients internationally. We're positioned in a state that's probably the most permissive place in the world for people to be able to use egg donors and surrogates. That really makes this really probably the premier place in the world to seek surrogacy care for patients.